So with that, we're going to give you a little role play psychoeducation.
Good afternoon, Elvis. It's good to see you again. My name is Matt, the social worker. You remember me?
Yeah.
Excellent. How are you feeling?
Okay.
I want to talk with you a little bit about the diagnosis that we've given you. So oftentimes when people come into the hospital, we give a diagnosis. We use this manual, the DSM. But it's important to know that it is a manual, and if I were to open it up and look at it, I could probably give myself or anybody else, 2 or 3 of these diagnoses. The purpose of this, and the reason why we do this, is to kind of make sure everyone's on the same page so that we can help you in the appropriate way. Does that kind of make sense?
Okay.
So the diagnosis we've given you is opioid dependence as well as sedative, anxiolytic, and hypnotic dependence, based upon the drugs that you've been using and the withdrawal symptoms that you've been displaying since you've been here.
But all the drugs I use are legal. I need them. I have medical problems.
I understand that, and obviously the ones that are associated with your medical problems will still continue to make sure that you're provided for. But simply because they're prescribed does not necessarily mean that they're okay. Anything in large doses can be significantly dangerous, especially these classes of drugs you've been using.
So what does this mean? Am I going to rehab?
So we're going to talk about treatment options later, but I want you to kind of start thinking about whether you'd be open to going to rehab, maybe a drug rehab inpatient setting where they can continue to monitor you as you're going through your withdrawals and help you learn some new skills so that you can possibly replace the substance use with more healthy coping skills.
Well, I don't want everyone to find out what's going on with me.
I understand. And we can talk about that later and kind of look for an optimal prime situation where maybe there'll be few people around you and you can maintain some sense of anonymity. Okay.
Nice work, you guys. So as we just saw in the role play, the last step that we left off is Elvis is kind of really curious about what is going to happen and what's going to help him. So as a team, we really dug into developing this intervention for him based on several different things. The first place that we turned is to one of our textbooks, which highlighted 5 different EB evidence-based practices that have shown a lot of success for people with substance abuse. We are going to talk a little bit more about brief interventions. We're going to talk more about CBT with coping skills strategies, as well as a 12-step facilitation process, which we've developed in our plan. However, we found that perhaps because Elvis is going through a divorce and doesn't necessarily have his mother there, as she's passed away by this point, behavioral or couple therapies might not be the best intervention for this particular situation. And then from there, after learning about what some of those treatments might be, we obviously went out and looked for data and studies about what are the success rates for these different interventions and what might be suitable for our client. Just to cover a couple of them, the first thing that kind of led us in our development was an article and a meta-analysis that looked at different types of patients and what their disorder was. And it found that for substance abuse, especially using medical prescriptions, that an eclectic approach might be the most successful. And we'll talk a little bit more about what that looks like, but that would incorporate many different treatment options. So we went that route and decided to branch out and look at, well, what are these different treatment options? We found that motivational interviewing, to incorporate that into whatever treatment we chose, would be probably most successful. We're going to assume that, like I said earlier, Elvis isn't completely gung-ho and ready to give up all these great-feeling pills. So using MI to really get him on board and motivated for the change that could be approaching. And then we also, for example, looked at CBT and found that CBT therapy, when also teaching coping skills, would be very helpful for a client like Elvis, giving him that individual therapy approach, and then as well as teaching him things that he can take with him throughout his life. So we combined those together and put together this eclectic approach. So we're going to start off, like I said, with MI, and we would consider, and psychoeducation. We are also going to incorporate medication. We'll talk a little bit about for doing that, but there are a lot of non-addicting medications that can be used to help people wean off abuse, substance abuse, and medication. From there, we would be incorporating a brief intervention, including motivational interviewing techniques, then using CBT and coping skills therapy. This is all an individual therapy process that we've decided on. And then upon release, upon conclusion there, we would be recommending an NA 12-step program. As far as locations for where these would all be happening and what time frame, we've tried to illustrate that here so that they align with the treatment setting and what exactly is happening at that point in time. So for example, after his release from or his completion of the residential drug treatment program, where he would be receiving individual therapy and CBT, we would then be working with him as a social worker to get involved in a 12-step program when he's home. So hopefully that makes sense. And from there, using this eclectic approach, we definitely would be engaging with different services and different disciplines. So psychopharmacology we would be using, obviously, if we're going to be introducing medication. Using a psychiatrist in that process would be helpful. We also added physical or occupational therapy. We found research that showed oftentimes when you are abusing a substance, a person after they've come off and kind of healed that part, they can see motor skills issues or things happening, and since he is a performer, we would wonder how he would function off of the substance abuse or off of the prescription. So perhaps physical or occupational therapy would be needed at that time. And all of these services would be coordinated by the amazing social worker. So explaining the plan to the client is our next role play, and again, Matt and Sarah are going to do a demonstration.
Hi Elvis, it's good to see you again. How are you feeling? Good. I kind of wanted to follow up with you and talk about the plan for discharge and how things are going to kind of look for you. I know you had some concerns about confidentiality. So we've looked into a treatment facility that has minimal patient interaction, where confidentiality is a must for every patient there. Hopefully that will maintain some sense of anonymity. But it'll be an inpatient drug rehabilitation program. So inpatient means that you won't be able to return home just yet. You'll live there, but they'll be able to help provide you some cognitive behavioral therapy. Are you familiar with that?
No, what's that?
Well, cognitive behavioral therapy kind of works on your thoughts and your feelings and how this relates to your behavior, to kind of help change some of your thoughts that might be dysfunctional or not helping you, and replace them with more appropriate, realistic thoughts of what's going on in your environment.
Well, why am I doing this kind of therapy?
Well, this therapy has great results, especially with people who have used drugs in the past. And it's also very helpful for getting along in day-to-day life. Very straightforward therapy. Okay, and then after that, they'll look at discharging you home, and then maybe involved in an outpatient therapy program, as well as going into a 12-step program. Are you familiar with the 12 steps in AA and NA?
Kind of.
Okay, so AA and NA work from a disease-centered philosophy that, alcoholism and other drug use is a disease that needs to be dealt with and understood with sensitivity and care. So there'll be a supportive environment, I hope, for you, in which they can kind of help show you that it's normal. It's a problem that happens with a lot of people, and they can kind of give you some support.
And who will be in those groups?
I understand that you're probably concerned about confidentiality. AA and NA have a strong philosophy about anonymity as well. So there will be people there, and we can try and find some that may be more suitable for you, like the inpatient. But that will be a concern as you are of everything else, obviously.